So hi guys, these are our group members. So now let us talk about lymphoma cancer. Lymphoma cancer is cancer of the lymph system, which is characterized by the formation of solid tumors in the human system which affect human cells by lymphocytes. Follicular lymphoma was described for the first time by Brill and Nimmer in 1925. Lymphoma is a group of blood cell tumors that develop from lymphocytes, a type of white blood cell. Lymphoma and leukemia are both tumors that are closely related. There are types of lymphoma: non-Hodgkin and Hodgkin. For pattern of inheritance, a unique pattern of inheritance is expected from mutation in a gene in the pseudoautosomal region (PAR). A man could possess the mutant allele on either his X or Y chromosome. If it were on the X chromosome, then only his daughters will inherit the allele, whereas if it resided on the Y chromosome, only his son will inherit the allele. Clear-cut inherited syndromes is a susceptibility to lymphoma. The susceptibility to neoplasm in general and lymphoma is associated with an acute sensitivity to ionizing radiation and to specific chemical agents such as bleomycin.
Genetic factors. It occurs in the follicular lymphoma, where the cell often have an exchange of DNA between chromosome 14 and 18, which turn on the BCL2 oncogene. The cause of follicular lymphoma is first the translocation in oncogene and tumor suppressor gene. So, if the cell damage P53 protein will repair the DNA or inhibit the cyclin, the protein also will take the damaged cell and perform an apoptosis. Mutation of tumor suppressor gene. It will become inactivated and unable to control the growth cancerous cell.
So this is the symptoms and stages of the lymphoma cancer, such as fevers, chills, unexplained weight loss, night sweats, lack of energy, blood in the stool or vomit, blockage of urine flow, and headache. The first sign of lymphoma is a painless swelling of lymph nodes in the neck, under an arm, or in the groin. Lymph nodes and tissues elsewhere in the body may also swell. The spleen, for example, may become enlarged in lymphoma. The enlarged lymph node sometimes causes other symptoms by present against: number 1, a vein or lymphatic vessel; number 2, a nerve; and number 3, the stomach. Enlargement of the spleen may cause abdominal pain or discomfort. The RISE system was originally devised in 1968. At that time, all that was needed to diagnose CLL was lymphocytosis, a high number of lymphocytes in the blood and bone marrow. It was originally defined as over 15,000 lymphocytes of blood and at least 40% of the bone marrow being made up of lymphocytes. Now, for a diagnosis of CLL, the patient must have at least 5,000 of monoclonal lymphocytes, but the overall lymphocyte count does not have to be high. Monoclonal means that the cell all came from the same cell, which can lead to them having the same chemical pattern on spatial testing. This system divides CLL into 5 stages. For the early stage, there is no enlargement at all. For the stage 1, only the lymph nodes is enlarged. For the stage 2, only the spleen is enlarged. For the stage 3, there are too few red blood cells count. And for the last stage, lymphocytosis plus thrombocytopenia, which is too few blood platelets. So for the early stage, it is considered low risk. Stage 1 and stage 2 are considered intermediate risk, and stage 3 and 4 are considered high risk. Drugs and effect. Drugs to people with immune deficiencies, autoimmune diseases, and chronic infections. People with immune deficiencies have a much higher chance of developing lymphoma than people without a weakened immune system. People with certain autoimmune diseases have an increased risk of lymphoma. People with certain chronic infection are also at increased risk. Non-Hodgkin lymphoma can also affect and raise. First one is age, second one is gender, the third one is exposure to chemical and drugs, next one is radiation exposure, body weight and diet, and also breast implant. There are 5 types of standard treatment are used. The first one is watchful waiting, which is closely monitor the patient without giving any treatment until signs or symptoms appear. Number 2 is radiation therapy, which is external radiation and internal radiation. The third one is the chemotherapy. The fourth one is the splenectomy surgery to remove the spleen. And the last one is targeted therapy, which is uses drug or other substances to identify and attack specific cancer without harming the normal cells. Treatment for the early stage is usually watchful waiting, and treatment for the rest of the stages usually target. Unfortunately, there is no known way to prevent NHL. However, it may be possible to reduce your risk for the disease by avoiding known risk factors such as obesity and HIV. And that's all from us. Thank you.
Created using Powtoon.